Good afternoon. We all strive to make the best possible evidence-based decisions. But as Olivia brilliantly pointed out, one of the main obstacles towards us doing exactly that is the difficult access to quality data analysis. And that's a big problem in the world. The good news here is that EpiGraphHub is a tool that aims at solving exactly that problem. So what is EpiGraphHub after all? EpiGraphHub is a tool that's designed to handle and bring together heterogeneous data sources. When I talk about heterogeneous data sources, I'm talking about data that were created in different contexts by different people in different times, and they're very hard to bring together and harmonize for analysis. But EpiGraphHub just does just that and allow us to do rapid exploration and dashboarding for publicization of such analysis. And it can also be a data backend for analytical apps. The main challenge when we start to develop such a tool is, first of all, interacting with the existing data infrastructure. And that means basically health information management systems, which is where the public health data actually is born. It is born when it's registered in some sort of data management system, which is generally managed by government. Those tools are great. They offer a number of tools for analysis, but they're geared towards a specific audience of public health professionals, government-based normally. So it leaves out a certain audience which might help in that. And that's where EpiGraphHub comes in as an open platform, secure platform, which is agnostic of data sources, being able to bring together data from multiple sources instead of being just a specialized tool. When you talk about health analytics tools in general, and when you have to solve such a problem of analyzing different problems in public health, we can go one of both ways, of two ways. We can go with off-the-shelf tools, which allow us to do a lot, but they have some costs attributed to it. They have some restrictions. They're typically not specialized in what we need to do, and they sort of lock us in a certain context for analysis, which is then hard to leave. On the other hand, you can choose the path of developing your own tools by writing your own software, and there are great tools out there to help you do just that. However, the human capacity to build those tools is not really very common, as we've talked about, and that's the main theme of today's event. And it can be quite expensive because of that, and it's not really responsive in a situation of emergency where you have to have results out there really quickly. So enter EpiGraphHub. EpiGraphHub aims to be this middle-of-the-road solution, which is accessible to both programmers and non-programmers alike, a fully open source tool, so meaning the minimum amount of resources required to maintain it, and at the same time being an enterprise-level tested software that you can rely upon. So what does it look like? This is actually one screen of EpiGraphHub that we show in this video. And we show the creation of a simple visualization that is the base, normally the starting point of many analysis. And you'll see throughout this video that after a few clicks, we can come with a very compelling visualization about whatever topic that we want to analyze, and all in the comfort and in the guarantee that of a server environment where you don't have to worry about, do my computer really can hold this amount of data? You know, it's all set up for you. But EpiGraphHub can go much farther. In EpiGraphHub, we not only integrate data from multiple sources, such as I already said, health information management systems, but it can also bring together data from primary data being generated by field studies. We actually provide our own Cobol Toolbox server for less resource-rich research teams that need a place to store their field collection data. And once you get all this data together, you have all the visual analytics tools at your disposal. And you can bring in other data sets which are not necessarily related to health, like socioeconomic data, demographics data, general census data. And we actually have integrated all those data sets in the platform ourselves now, and it's a constantly growing set of interesting data sets that you can enrich your analysis. Anytime you start to work with EpiGraphHub, you can even bring data from a Google spreadsheet into the platform very easily and integrate that with your analysis and other databases. Security is a very important point when it comes to, accessing and using public health data. We all know that. And EpiGraphHub offers a very detailed access control to data sets so that we guarantee that public and restricted access data sets can live side by side on the same server without compromising the restrictions that need to be imposed on data sets that are of sensitive nature. So you can be safely assured that you can work with any kind of data set within our platform. One other point that comes to mind when we think about such a solution is where does it live? Well, how much does it cost? Well, we are quite flexible in a way that we can provide this service, this platform actually, since it's open source, anyone can actually take it and work with it without our help even. EpiGraphHub is very easy to set up in any server, private owned server, so an institution could install it in their local intranet. It can be hosted within any country that can, for some reason, allow data to go abroad. Or if there are no such restrictions in place, the partners can work with our own cloud servers, which already have EpiGraphHub ready for anyone to use, actually. So, but EpiGraphHub goes way beyond just being a web-based platform for visual analytics. With the EpiGraphHub libraries, we also provide a full set of open source analytical methodologies, which are based on our previous experience as public health researchers and analysts, and that's made available at no cost to all the community that wants to use it. And of course, this community can also contribute back to these libraries and enrich the whole experience for the whole team. So if we think about a concrete example, say we want to look at a complex problem such as the burden of HIV in a country, we know that we'll have to look at several layers of data, survey data, social and demographic data, longitudinal studies. How can we bring this all together? Well, that's exactly what EpiGraphHub is here to do. It actually facilitates this data integration and hands it back to you in an easy to manipulate and analyze way. Of course, I don't have to tell you that it's a great tool for educating new analysts. Everybody that has ever tried to learn to do data analysis knows how hard it is to find exciting and innovative and relevant data sets to work with. And EpiGraphHub actually is the repository of data that's going to be used by the graph courses to train the next generation of analysts. So that's another application of our platform. So even though the time doesn't allow me to go much further in everything that EpiGraphHub has to offer, I'd like to say to you that it's ready for you to use right now. You can go to this website, you can log in with a guest user account and browse some of our public dashboards that are already published there for you to enjoy. And I'd like to finish by saying that we are ready to unleash the power of data analysis on a global scale. Will you join us? Thank you.